when we're looking at performance training for athletes of any ages, one of the big considerations we need to take into account is volume. And specifically, I'm going to talk a little about volume in terms of maybe older athletes, or, and again, whether this is an athlete that is in college but has a ton of prior medical history from an injury standpoint, or your middle-aged athlete that you're seeing or whatnot. It's going to revolve a little bit more around that, and even from kind of my own experience as well. So volume, more than anything, is more early on in your training career or training age. Like, volume is a positive thing, because it's going to allow you to develop, or help allow you to develop the structural changes along with intensity that you need to support higher intensity activities, whether that is from a lifting, sprinting, or just your sports standpoint in general. However, as we get older, there's very much the case where less becomes more. So what do I mean by that? Meaning that what you maybe were able to do from a training volume standpoint, whether that is per session, per week, per month, 5 years ago, if you try to do that now, that is probably going to put you in potentially a more negative situation, because in a lot of athletic cases, like 5 years go by, there could be a much greater history now of injuries that they've accumulated, not only regular or non-surgical injuries, but surgical injuries as well, that they've now accumulated and has a total effect on the body more than anything. So when we look at that, we now want to say, our focus now wants to shift towards less is more, but how much less? So a lot of that is very dependent on the athlete, where some athletes, they can maybe still, maybe they used to train 5 times a week, they can now maybe train 3 times a week. But for some athletes, it might be a matter of, they can only train twice a week compared to the 5 times a week they used to, but that twice a week allows them to still have positive adaptations that transfer over to their sport, instead of having them train more, and now it puts them in a not as appropriate state to then excel at their sport. And that looks different for every athlete. And the other thing that we need to now take into account, especially if we're dealing with an older team sport athlete, is how does their sport in general play into their overall volume and load? Is this an individual that during practice they are still running around everywhere, whether it's at high intensity or lower intensity sub-max speeds? It's still stress on their body. So we need to take that into account and then say, okay, how does that influence what we're going to do in the weight room? So if we know that there's an individual that whenever they have a ton of high speed exposures in practice, let's say football, for example, whenever they have a ton of high speed exposures in practice, they're usually, both from a physical and a CNS standpoint, pretty fried for the remainder of the day. So instead of maybe doing the 5 exercises we had planned out, we might only get to do 3. And that's okay, because if we were to go over those 3 exercises in this case, that might then put them in a position where they are not ready for practice the next day. So we always need to take into consideration, how does the sport alone play into the other factors that we are trying to drive from a performance standpoint, whether it's strength training, explosive work, medicine balls or jumps, and then sprinting alone. So sprinting is another perfect example. You have an individual that's getting a ton of high-speed exposures in practice. We probably don't want to be topping them off or increasing their sprint exposure in before, or especially not after practice, but even before as well. So we want to take a lot of those factors into consideration and really just make sure that we are training older athletes. And older can mean whether it's from years or training age or just total injury history in general, because that is going to create a similar effect of aging on certain structures than maybe their teammates of similar age. We want to make sure that we are taking all those into consideration when we are determining what is the appropriate stimulus that we need to give this athlete outside of their field of practice, to make sure that they can still continue to perform at their sport, because their ability to be available and perform at their sport, that is the number one priority above all else, and we have to figure out how everything else affects that leading into it.